I'd like to welcome you, especially our guests from Uganda here, so thanks for being here. Good morning and welcome to the Primetime. Primetime is at the BU Library is a celebration of the experiences and the accomplishments of Bethel faculty, students and staff, and it's a collaborative project between the Friends of the BU Library, faculty development, and other offices on campus. Most presentations are recorded and can be found in the BU Digital Library. Be sure to check the library news and events webpage and the BU calendar for what's coming up on the schedule. Join us on Thursday, November 19th, as we welcome Dr. Andrew Bramson, Assistant Professor of Political Science, as he explores the question, how does popular fantasy literature reflect changes in the perception of authority? Today we welcome Drs. Karen Drake and Pam Friesen of the Nursing Department, who will present their research on a retrospective comparative study with students at Bethel and Uganda Christian University on perspectives on global health. Okay.
Well, before we begin, we would like to introduce 4 of the students who are actually from Uganda who took the course in Uganda. So if the 4 of you would stand, we'll just introduce Mary Namaguzi and Eveline Kyomugisha and Zakayo Masareka, and then we have Christine Nakasine. So thank you for coming. Our third presenter, Jamima Mutabazi, also is in Uganda and can't be with us, but has been a part of our research project. She is the director of the nursing program at Uganda Christian University, and this is actually the 3rd program that she helped to establish in Uganda. She's a graduate of Case Western in community health nursing, and up until very recently has been the chairperson of the Uganda Nursing and Midwives Council. Our objectives for the presentation today are to describe an example of an international collaborative learning experience for graduate nursing students. We also want to analyze the benefits and the challenges of this international collaborative learning experience, especially in the online environment. We want to suggest some strategies for the future for anyone who might contemplate doing an international collaborative learning exchange for graduate nursing students.
First of all, we want to provide some background on the international collaborative learning experiences and what we found in literature. Much of the literature that when we did our searches, was about Western baccalaureate prepared nurses that are on faculty-led trips, BSN students. And most of this was anecdotal. We have found limited research that was done, especially in particular to graduate education. The exchanges that we found were primarily for faculty development, for nurse educators who are working with faculty in other countries, and you can see the combination of some of the countries that we found in which faculty are working together. The vision of the ICN, or the International Council of Nursing, provides support for international collaboration, as evidenced in the vision statement of the organization. The ICN advances nurses, and health through its policies, partnerships, advocacy, leadership development, networks, congresses, special projects, and by its work in the arenas of professional practice, regulation, and socioeconomic welfare. The other organization that does promote collaboration as well is the World Health Organization. And this is an organization that is working worldwide. You can see some of the initiatives that are a part of WHO. One of the things that I just want to comment on is that the Millennium Development Goals these were 8 goals that were created by the United Nations to address the needs of the poorest countries. The goals were designated to be met by 2015. Well, 2015 is here, and not all of our world issues are resolved. So in September of this year, the Sustainable Development Goals, there are 17 of those, have been designed now for carrying into the next 15 years. So the 17th goal says revitalize the global partnership for sustainable development. So here we have a focus on partnerships and collaboration. The Institute of Medicine report also has been an important document for nursing and has stressed that nurses need to practice to the full extent of their education. This report also highlights the required competencies for nurses. Nurses are being called on to fulfill expanding roles and to master technological tools and information management systems while collaborating and coordinating care across the terms of the health professionals. Given then the lack of literature that we found, Dr. Kieran and I decided that we needed to do some research in evaluating the learning experiences of our graduate nursing students through the collaboration of this international partnership and within the context of a hybrid course, our global perspectives of health.
Before we go any further, let us tell you a little bit about our partnership with Uganda Christian University. It is also a member of the CCCU, the Christian Consortium of Colleges and Universities. And we began collaborating in 2005. I helped to assist them in getting their degree completion program going. It has been a site for Bethel nursing students for many years to go during interim for their study abroad, and we also did one fall semester there. In addition, Bethel faculty have been involved in both the development and the teaching of the master's program, and Uganda Christian University students have come. We now have the fourth cohort who are here. That is a very large cohort. There are 15 of them. So we have started with just 6, and the remainder will come and join us in the spring. Bethel University, our campus, has pre-licensure nursing program, degree completion, and master's program. Our master's program began in '97 and currently has an active enrollment in the nurse educator, nurse leader, and now our newly established nurse midwife programs. Uganda is located in East Africa, and the university is located in Mukono, which is right here, about 23 kilometers from the capital, Kampala, and here is the airport where we all arrive and depart from. Like Bethel, UCU has a pre-licensure, degree completion, and master's in nursing program. The nursing master's program began in 2008, and when the first class graduated in 2010, Dr. Jay Barnes and his wife were present for the graduation, and in fact, Dr. Barnes was the speaker at that graduation. We now have taken our 6th cohort, and as you know, we have 6 students from the 4th cohort here. I am currently the director of the program, though very recently I have been blessed to have a co-director in Uganda, and many faculty, mostly from Bethel, but from a few other universities, do help us to teach in that program.
So why collaborate in a global health course? The AACN, the American Association of Colleges of Nursing, essentials state that the master's degree program prepares the graduate to synthesize broad ecological, global, and social determinants of health. Uganda is as a country, does not have specific design curriculum as of yet at the master's level. UCU is the only institution that has a master's program. But there is a focus on cultural diversity and competencies. This is very much an important part of their undergraduate curriculum. The mission statement of both schools is preparation of nurses who serve with excellence a diverse and changing society. And both have the identical core course, Global Perspectives of Health, so it was a natural melding of the two in relation to this collaboration.
So let's take a closer look at the course description. Development of a global perspective on social determinants of health, integration of concepts from epidemiology, ecology, economics, politics, and religion in determining culturally responsive strategies to improve health. When UCU began its master's program, the first cohort came to the U.S. to take the course face-to-face in 2010. This was very successful, but not really financially sustainable. So we sought for other ways to keep the collaboration while making it more cost-wise. We developed a design that was online using Moodle as our tool for collaboration.
Let me tell you a little bit about the formats of this course. At Bethel, we have had a weekly hybrid course for 6 weeks, but we're now transitioning to the all-online format. At UCU, there are parts of 6 weeks that students are daily on campus and are taking classes and doing coursework. The classes are videotaped and then uploaded to Moodle, and feedback is also given to on each side. Once the videos are actually uploaded and sent to the other university, then students watch that and feedback is given. There's also discussion forums that we are using between the two, where there are students from each institution who are within those discussion groups. Within the Bethel cohort, each year we have students from diverse backgrounds that also can contribute to the discussion. We've had students from China, from Kenya, Liberia, Ghana, and Americans who've grown up in international settings. We often notice that for the first time, these students begin to start opening up a little bit more about their backgrounds and are able to share their stories with other students.
At UCU, we also have a diverse group. In UCU, there are 56 tribal groups and many different languages, and our students represent a good number of these. We also have had one student from Nigeria and currently have a student from Zimbabwe. The course itself includes a few lectures at the start to get it going, a debate, but the most collaborative assignments are the Malika case study and the presentations. Malika is a fictitious course that was developed by our retired colleague Nancy Olin, and it is created from an aggregate of issues and has stood the test of time and works very well as a case study. Faculty give questions each week about Malika, as well as asking students to make some comparisons between their own health systems, and these are posted to small group discussions. In addition, as Pam mentioned, the presentations are on various global topics. They are given at each university, recorded and then played in the opposite, and then also many times either verbally or in another recording, or by email or into the discussion forum, more feedback is given. These are some of the topics we have used, but these topics do vary from year to year depending on what's going on. This past year we included Ebola and Marburg disease due to what was going on in our world. So the purpose then of our study was to explore and analyze the experiences and learning of graduate nursing students through collaboration with international classmates within the context of the online course on the perspective of global health. We chose as our conceptual framework constructivist learning theory and collaborative learning environment, which have been found to be interdependent in regard to the role of the faculty and participation in learning activities and student learning styles. So literature pointed out the interdependence, also that learning is participatory, and that process develops meaning through the multiple perspectives. Knowledge also comes from experience interacting with others, processing multiple perspectives, problem solving through developing shared community. Our methodology, as was mentioned in our introduction, was a retrospective comparative study. We used a Qualtrics survey to collect data from consenting students from the classes of 2011, 2012, and 2013. One of our survey had Likert questions, which resulted in our quantitative data, and also students were given the opportunity to comment freely with open-ended questions, and that resulted in our qualitative data. We had IRB permission from both universities, and our results, we had what we thought was a pretty good response rate of 53 from the possible 77 students. 23 were from Bethel, 30 from UCU. We had not really anticipated that our UCU students had never taken an online survey. So while they were successful, they reported they had some struggles in really understanding that process. Our quantitative findings, I hope you can, it's a little bit maybe difficult to read, but the results were strongly positive for both universities, and this table is actually a comparison of the means on the level of agreement between the two groups of university students on the Likert scale items. The means for all items were significantly higher for the Ugandan students. Their means were between 3.64 and 3.95 in comparison to the US students, whose means were at 3.07 to 3.45. There was one exception, and that was the item related to challenges in taking an online international collaborative exchange. In that question, there really was no significant difference between the two groups, Uganda at 2.91 and US at 2.79. And this seemed to indicate that both groups reported a similar sense of the challenges there were with taking this online collaborative course.
And a look at our qualitative findings. We want to share with you the findings from this data on the benefits and challenges of collaborative learning. These were some of the themes that we extrapolated. You can see the one-word descriptors that students had of collaborative learning through this course. And I think as educators, we don't always have the opportunity to be involved in learning activities that are so overwhelmingly life-changing and transforming for students. The themes then related to benefits. In the analysis of our data, we found 4 primary themes: relational cultural development, personal development, professional development, and spiritual development. And I just want to share some of the main ideas and quotes that came from each one of these themes. Students reported developing personal relationships with people from other cultures, learning from one another, and being able to view one another's cultural perspectives. One student described this type of cultural learning as more interesting, more engaging, and more emotional to actually interact and begin to understand more about another country and culture while building a relationship with people in that country and culture. Our second primary theme in personal development, one U.S. student felt that his or her sensibility of the world was enhanced. It stimulated my way of thinking and articulating issues. I have greatly expanded empathy and understanding of the world beyond the familiar. Students in Uganda described this from their perspective, that their self-esteem as global nurses had been enhanced by these interactions. One student said, "The course helped me to develop my confidence and the way I approached issues." Students reported that the course gave them a sense of equality with nurses everywhere. "This has raised my self-esteem, and I feel I could work as a nurse in the world." Professional development. Students expressed that finding similarities they were often unexpected. I was able to see how developed nations were much better equipped to educate and set up prevention efforts, but was shocked to find out how many of the same health challenges were the same in both the developed and the developing world. This course also empowered my computer skills. It makes you become a global nurse. They reported that technology helped them to feel that they truly were taking a collaborative course with classmates who they felt close to through technology, even though they were at a physical distance. Students expressed that the course gave them the opportunity to exchange ideas, thinking, beliefs, cultures, and nursing professional issues in an in-depth dialogue. One student said, "First and foremost, I was able to learn from colleagues from different cultures with whom I think it would be close to impossible for me to ever meet and share experiences with." Ugandan students reported that learning about the U.S. health care system was a surprise to them. They addressed how misperceptions they have had, and even a sense of deception had been created in the past in their understanding about the U.S. healthcare system. One student said here, "It was very beneficial to learn some of the challenges they face because many times we are deceived that nurses in the developed world do not have challenges, a lie that has greatly contributed to the migration of nurses. My eyes were opened, and at least I know now, and I have the knowledge of what happens and hence cannot be easily deceived. The last theme that we found was spiritual development. One student commented, "Though there are many differences, these should not divide us, but unite us and help us to work together to promote health." Another student clearly articulated the value of serving from their health-based perspective. It was such a wonderful experience to know that nurses globally serve mankind with a Christ-like perspective. They also found that prayer was a means of connection.
You can also see from the one-word descriptors that there were challenges as well that were described by our students in this global collaborative course. We had the following themes, which I will talk about one at a time. In regard to communication, there were several issues. The first one around the discussion forums when the communication was primarily written. Students said it was challenging because there was only the dimension of the written word when emotion and expression of face-to-face contact would have contributed greatly to my understanding. In spite of the hindrance of the written communication, students still reported that they had important exchanges with their colleagues. In regard to the delay of communication because of the difference in distance, one student said, "There was a delay in communication with my partner in Uganda due to internet problems." A U.S. student talked about the communication style. "I felt bad that Ugandan students had to listen to our fast American talking." Both Ugandan and U.S. students noted difficulty in understanding each other's English. "I had trouble," one student wrote, "understanding presentations due to accents." Technology was also bound to be an issue in an online course. In regard to internet, one Ugandan student wrote, "The most challenging issue was internet network, which was on and off. I would fail to access electricity for like 2 days." Ugandan students reporting having stress of learning new technology during the course itself. And then the quality of the recordings themselves. In spite of the very high-tech classroom in the U.S. setting, when the recordings were subsequently played in Uganda, it was difficult to hear and understand, and one student described it this way: "Most of the recordings from our colleagues had very low volume and we strained our ears in order to grasp what they were saying. The solution that we developed was to pass a microphone, which the U.S. students found very inhibiting to the natural flow of conversation. One of them wrote, "Technology was a frustrating piece in class. Passing the microphone or being interrupted to speak louder tended to break my concentration and caused me to lose my train of thought." And as you can imagine, the time zone difference resulted in some challenge. Another student described this consequence of the 9-hour time zone difference as the fact that because we were from different time zones, we worked really hard to finish our assignments, but only to wait the next day to get a response. Both student groups described the workload, the nature of this course, the short time frame, the communication across nations, and the subsequent course assignments were at times overwhelming. One student described this course as very hectic because there was a lot to be done in a short period of time. As we think about discussing our findings, we first want to look at them in regard to the conceptual framework that we chose. And our study did support the notion of the constructivist learning theory and collaborative learning environment, the fact that they are interdependent. We saw learning through active engagement. Our students were enabled to construct meaning from the multiple perspectives they realized. They were provided with real-world experiences, and they developed a shared sense of community irrespective of the geographic distance. Our findings were also consistent along the area of benefits. Others found that international study partnerships resulted in the development of rich personal and professional relationships. Others also have reported, as we found, that learning together could happen without traveling, and that this kind of learning promoted cultural competence and increased confidence and self-assurance from international collaboration. There were more benefits. The idea that students discovered similarities as well as differences. And the depth of the online interaction, students commented, was more authentic than just reading about something in literature. And others, like ourselves, found that the interaction between the two countries resulted in an increased awareness of healthcare issues. And students applied their learning professionally. Similar challenges that we experienced were reported by others. Delays in communication from time zone has often been frustrating. The difficulty of trying to do anything synchronous is problematic with the time zones. And the issue of figuring out how to communicate in a culturally relevant way, and these patterns could also become challenges.
The students also made recommendations, and many of them talked about that this should remain a part of the curriculum. There were multiple students who really enjoyed this course and encouraged this to continue. Also having some live interactions, maybe with Skype or scheduling it for a time that students in both settings could be having the live interaction. Having the choice to take the course in another country. We've had one student who has gone to Uganda from Bethel and taken the course with the group there. And we, as Dr. Kieran had said earlier, we've had UCU students that have taken the course with us here. Ensuring that students are comfortable with online technology before the course begins. This is something that we know that we do need to be working on more in relation to, on both sides. Refining the technology to get better recordings. This was definitely a challenge for them and something that we can be working on. Offering other courses in similar format. So maybe this could be used for other courses within our master's program. Now, in evaluating what we have gleaned from this study, just want to share a few of the lessons learned and recommendations. First of all, we had thought through of maybe beginning the course with having students do the introductory videos so that they can begin to hear one another speak, to learn how to be able to understand as far as through accents, through the speed of speech, just differences in communication styles. Also considering the time zone differences and the assignments and when those are due. Considering the synchronous exchanges, as I just talked about. Perfecting technology for capturing video presentations before the course begins. Ensuring that students are all comfortable with that technology as well. Designing some different strategies in order to encourage even more student exchanges on that personal and professional level. And then also ensuring that faculty members have a meaningful understanding of each other's academic, cultural, and professional environments.
Now, if this works, we're going to play a 1-minute segment from both a Ugandan student and a student from Bethel. And in the Ugandan one, we sometimes forget when we're there how much background noise there is in our environment. So you'll get a little flavor, and so it's therefore a little bit on the softer side. You'll have to listen.
Like bridging the gap. Let's say at first we were like our colleagues are very far, but during that interaction we became closer and closer, and we were able to trust each other to the extent of beginning to communicate social issues. It gave an impression like we are in the same class, and yet they were really far from us. And then another one, it improved our computer skills. We got the skill because we were able to really type. The speed of typing also improved greatly because we had to catch up with time. It was really very interesting because Dr. Karen could always encourage us, and she would like comfort us. She would say, no, you are even capable. And what motivated us to work better was that our video coverage in Uganda was even better than the one in Bethel.
A lot of times you can read about different places and read about different experiences, but until you actually really interact with them, it doesn't really become part of your learning. And I felt like this experience was really one of the highlights of my master's career. I felt like I was able to be in Uganda and really understand the challenges that they face and some of the opportunities that were presented to them at this critical point in the development of their nursing. I was able to ask my partner, we got beyond just the learning, and we talked about our families, we talked about the interactions that we had in our careers and some of the opportunities that we have as nurses and as people in our own countries, some of the opportunities locally, and also even some of the laws surrounding what nurses are able to do and the opportunities that we have in our careers. I found that to be very rewarding, and I felt like I was able to ask the important questions that I needed to know about nursing in another country. It's really made a huge difference in even my ability to care for international patients that I have. I feel like I understand how to just even ask the questions in a different way, and it's been really rewarding.
I want to end with a quote that we feel like summarizes the impact of this collaborative learning. This is one student who said, "This is one of the graduate courses that will remain with me forever. I have not had the opportunity to travel abroad. It allowed me to connect with others that were in a very different circumstances. Although our daily struggles may be different, I truly feel great respect and admiration for the way our colleagues approach the challenges in front of them. I learned much about the human spirit and ability to persevere, things that are difficult to capture from a lecture or a textbook. Those are life lessons that I will reflect on forever in my nursing practice." We have our references that we used in relation to preparation for our research and for an article too that we have submitted. We haven't heard about it yet as to what whether it's been accepted or not. And we do thank you all for coming. Are there any questions or comments?
And you can also direct questions
Yes.
to our 4 students who have actually experienced the course. Any questions for us? Okay.
One of the points you kind of mentioned as a benefit was the increase in cultural competence. I'm curious if you could talk about that a little bit more. What kind of, more specifically, what kind of increases did you see, kind of on the part of the Ugandan students and the students from the U.S.?
I think in relation to even like say with the U.S. students, it opened their world. And as from this quote, the student said that it's made an impact in regards to even like say her nursing practice and giving her more understanding of how to be able to communicate, how to be able to, just get into kind of inside the minds of people from other cultures, which indeed can be applied when you're thinking about nursing practice. And so that, cultural competence is a very broad topic, but that can be a part of it in relation to just being able to communicate and being able to share ideas. Maybe you can.
Would one of you like to comment about what you felt about how you learned and your cultural competence might have improved? Go ahead, Mary, stand up. I can hear you.
Thank you very much. I'm Mary. What I felt about that course, because I was one of the students who took it, we used to share a lot. They would tell us how they work in the hospital and how we work in our hospital. So they would share with us, tell us about how confidential patients' information is. And so we came with that in mind, that when we come here, it's totally different from our country. Because for us, you'll find a patient's file by his bedside. So anyone can access it and read patient's information, and even when they are not supposed to, but because they can be able to access, so they can read, know the diagnosis, know what is next, what they have been able to do and what they haven't been able to do. So when we came here, it's totally different, and we already knew about it. So we were prepared culturally, what to say even in the corridors and what not to say. Even when we are at home, we are very, very sensitive because they used to tell us about their culture. And you know, they even told us how they walk, how they talk. So we came ready because we were prepared. And I think it was a very good thing on our side, which made us culturally competent and culturally prepared to be in another culture. So we are learning more things, but already we had that kind of perception, which has really greatly helped us. Thank you.
Yes.
What have you found to be effective for y'all in supporting the students with their academic writing through your blended delivery system?
Well, I would say probably this course isn't one of our strongest courses in terms of writing. You know, I think we do that in many other courses. So there's a lot more verbal in terms of they present with presentations using, each group used PowerPoint that we captured by video. And then in the discussion forums, we just didn't want to tamper with whatever was helping discussion, so it was free flow. The debate was again verbal, so there was a lot more verbal and that sort of thing than actually focusing on any kind of writing. So this course really didn't attend to that. I think that Uganda students will, one of the benefits for them was when the US students hosted their first discussion, which was required to have some supporting literature. We have been working at that. Their access to literature until they have tapped into Bethel resources have been limited. And many of them talked about learning from observing how the other students put a paper together, how they cited, how they were good at accessing literature. So certainly on the Ugandan side, it was the things we've been trying to say over and over, there they saw with their colleagues, and I think that really helped their learning curve. I think I see nods, so I know that that's how they felt when they were taking that.
It really was a mutual benefit on both sides for them to be learning in regards to what they're writing and how they're writing.
Thank you.
Other questions? Yes. Thank you.
So I'll be honest, I missed like most of your presentation, but so do you, this was at a master's level.
Yes.
So like in CAS we have this Z-tag issue where students who don't study abroad, don't have time for service learning, would something like this work for a 18, 19-year-old who has very little international experience and very little motivation to have cross-cultural experience? Do you see a developmental piece here? Any thoughts or ideas?
Well, the motivation is really, I mean, with our graduate students on both sides, the motivation level was, and the engagement was really, really high. And I think that's why there were no problems on either side with engagement with the student groups, other than the time zones and some of those kind of struggles with technology.
I think our CAS students, I think would definitely, they would engage in something like this. They love going to the other countries and being able to study there. But I would say that there would be motivation on their part too, to be getting to know students in other countries. And so it's something to think about in relation to our undergrad students.
There might be some less tolerance for the communication issues
Sure,
and
sure.
internet issues, you know,
Yeah,
the technology.
Certainly at the master's
Yeah,
level.
they might get frustrated easier.
Oh, I'm sorry.
No, that's right.
On the master's level, students are in both settings pretty articulate about, they analyzed, you know, they had enough courses so far, the ability to analyze their own health systems and speak about them. That is a little higher level because of where they are developmentally. But I certainly think it would be worth,
Yeah.
I mean, even if you had part of the success that we've had at this level, it would be worth it.
It's a good question.
It is,
It is.
especially as we go to more online courses.
Quick question. It seems like the course really revolves around effective cross-cultural communication. Just curious if there were pieces you built into the course to really help prepare students for that, or looking back on it, would there be pieces that you might add to that to really, on both ends, help students really understand what they're entering into, you know, of having a really clear communication process?
I think for the U.S. side, I think there is more preparation that needs to be done. I see. I have taught the course more here at Bethel. Had the privilege of going to UCU last January, but in retrospect, I think there is more, especially in being able to for the understanding and even telling U.S. students, you know, just slow down just a little bit on how you're speaking and not, you know, rattling off as fast as what we so many times do. And so to give them some guidance in some of it, especially the communication styles.
And some of the problems with the video were some were so soft-spoken. I mean, and that happens on both sides, but some voices really are picked up better in that classroom discussion when we were trying to record it. And so that made it very difficult. So, you know, I mean, our students are preparing to be nurse educators, so asking them to articulate and speak loudly or clearly would be important. I think on the Uganda side, we've tried a little bit now to introduce them to Moodle and some of the other things. Their learning curve of technology, if they were getting that at the same time they were taking the course, trying to figure out how to get them registered at Bethel a little earlier so we can do the orientation to Moodle. You know, it comes right at January, so you can't really ask people to come before New Year's and get up to speed on the technology. So I think on that side, the technology would be really would have helped.
You know, and that might resolve a little bit because UCU now is using Moodle. I mean, they're just starting, and it's a you know, earlier version. But as more colleges and universities are thinking about that, I think that will help. I was thrilled about that. Yeah.
Thank you very much.
Thank you.
For coming.
That's amazing.